We realize that antibiotics are a powerful tool for both animal and human health. They can be used to prevent and treat infections caused by bacteria. However, when antibiotics are used improperly, bacteria can become resistant or unresponsive. So this is called antibiotic resistance. Antibiotics can continue to be effective for prevention and treatment through good stewardship and responsible use, which is the goal of this module. So actions that preserve the effectiveness of antibiotics while maintaining animal health, such as only using antibiotics when necessary, establishing best management practices like use of vaccines and disease prevention plans to reduce the overall need for antibiotics. Livestock owners and veterinarians working together is important to make these decisions that improve animal health and welfare long term and reduce the need for antibiotics. So lack of effective treatments can result in poor animal health and welfare, resulting also in reduced livestock productivity, increased health costs. However, by establishing an antibiotic stewardship plan, we can reduce the animal's risk to developing antibiotic-resistant infections. So the more that we all understand how to effectively treat animals, the more sustainable our farms and the more sustainable our practices can be. While some healthcare tasks can be performed by producers, a veterinarian is undoubtedly an invaluable partner in treating illness and infection, and in many cases necessary to get the proper treatment. So under FDA's guidance for the industry, number 263 that happened here in June 2023, all medically important antibiotics that were previously available over the counter now require a prescription from a veterinarian for legal use in animals. So when animal drug sponsors make the voluntary labeling changes recommended in the GFI number 263, the relatively small number of medically important antimicrobial drugs that are currently available over the counter, OTC, would then require a veterinarian's prescription. So obtaining these drugs under a veterinary supervision can help guide the judicious use of the antimicrobials and slow the development of AMR or antimicrobial resistance because veterinarians have specialized training and experience. So sometimes antimicrobial drugs may not be necessary for proper treatment, or a different antimicrobial may be a better tool than the one you're used to using. So providing animals with the most appropriate antimicrobial is more likely to effectively resolve the infection and reduce the need for repeated or extended courses of antimicrobial therapy. This will not only help reduce the AMR risk, but will also help to ensure better health outcomes for the animals and can also save some time and money. So after animal drug sponsors make those changes recommended in GFI 263, producers still have access to appropriate antimicrobials to address animal health issues by consulting with this licensed veterinarian with whom they have established a valid veterinary client-patient relationship, the VCPR. And just because a drug is a prescription status does not necessarily mean you are required to purchase directly from the veterinarian. Although certain state requirements may also apply, you may be able to purchase prescription animal drug products from various suppliers and distributors with a valid prescription, again provided by a licensed veterinarian. Although specific requirements vary by state, vets are generally not required to examine each individual animal for which a prescription is issued, as long as the vet has an established VCPR with the farmer or the rancher that owns or cares for the animal in need of treatment. So establishing the VCPR generally requires, among other things, that the veterinarian has become familiar with the management of the animals on a given farm or ranch by examining the animals and or visiting the facility where the animals are managed. So farmers and ranchers may want to have a plan in place for getting access to appropriate antimicrobial products to address animal health issues when a veterinary visit is not feasible or not considered necessary by the veterinarian. And if you have any other questions, there's more information that can be had. Some of these links that are actually provided here in this slide can actually be accessed for frequently asked questions. So appreciate the watching, and this has been Larry Tranel, Iowa State University Extension and Outreach Dairy Field Specialist for Northeast and Southeast Iowa. Thank you.